Gentlemen, we are going to be talking about Apple's announcement. I think it was earlier this month, like the 5th or 6th of this month, or something like that. That basically you can report to your phone how you feel you are with your mental well-being and your welfare. And one idea, what on one hand, I love the idea. I think, but as somebody who maybe I need a tinfoil hat, that's a lot of data for a company what can sell your data to marketing companies. You know what I mean? Imagine like your phone can report back to thousands, arguably millions of advertising companies, whether you're depressed, whether you're happy, what your mood you're in. I think that's terrifying.
Right. So the comment that you said literally before we started recording was you weren't too sure about Apple, but if Google were doing it, you were going to be fucking terrified.
I would be more. I'll be more. I'm very much in Apple. I'm very much in the Apple ecosystem, and in
Okay. You're in the Apple
that,
ecosystem, but that doesn't mean that they're not doing shit with your data.
oh no, absolutely. They say it very, very clearly in their terms and conditions. And but the one thing I would say, Apple was the first one who basically told Facebook marketing to do one. They blocked a lot of the stuff. And that's why Facebook marketing and a lot of paid advertising actually isn't as successful as it was.
Mm-hmm.
I think what there's two things for me here. It's just I do not believe reporting to your phone about your well-being will help whatsoever. Lockdown proved quite clearly that human interaction caused a lot of problems in this country, not this country, worldwide.
Lack of human interaction, do you mean?
Yeah, absolutely that. So for me, I think we're moving in dangerous ground, but there's also that arguably abuse of knowing.
Data.
Yeah, that absolutely terrifies me.
Isn't it really?
And I think
can I add a third?
Please do.
Apple aren't working alone on doing this. They're working with a company called Biogen, and Biogen are a private company who are involved with developing. They're a pharmaceutical company, and there's two things there. One is that they view mental health very much through the lens of neurological disease. So what they're actually looking to track is they're looking to track signs of anxiety, depression through what your watch tells your phone. So it could be your heart rate, your sleep patterns, and there's a whole conversation there to be had about the accuracy of technology, because healthware apps are still very, very primitive in what they can and can't pick up. They're not very good, for example, with measuring sleep accurately. And if you've had to listen to me go on about sleep before, you'll know that I really believe that there's all of the evidence shows that almost all symptoms of mental ill health can be seen through the lens of REM sleep and made worse by poor quality sleep and what have you. So I'm passionate about the importance of sleep, but the accuracy of healthware apps with measuring sleep is still leaves questionable, a lot to be deserved. Questionable for sure. Mm-hmm. And then there's the other thing is that the Biogen develop and sell pharmaceutical interventions for neurological conditions. So when they talk about therapies, what they mean is pharmaceuticals. They don't mean connecting you with your nearest screened and skilled therapist, or with a talking group that could better help you to meet social needs if you're isolated, or
to change your state of mind rather than
yes. And Steve, as Dan has alluded to before we started recording and otherwise, to use that data to inform the intervention that Biogen will then recommend. That's how it looks to me anyway. It's not Apple working in isolation.
I mean, that's a whole kind of worms, isn't it? Because I mean, if you kind of look at the data, that big data that kind of sits behind a lot of the apps and stuff we use anyway. Use Tesco for the example. If they know that you've bought a 6-pack of cider on a Friday afternoon at 2:00 when it was 23 degrees outside, guess what? Next Friday when it's 23 degrees at 2:00, you're going to get notified of it. Yeah. So does that mean that the next time that you're feeling down, there's going to be a pop-up and say, just to use an example,
you need more tablets?
pop into your pharmacy and take more time. That's very, very dangerous then, because actually you're encouraging people to kind of go into a pharmacy and take all of this.
Well, they're
these tablets, this
prescribing
medication.
almost at that point, which you need a license for.
Absolutely. Now, I think the first evolution of this is quite interesting, but when you get to the third, fourth, fifth evolution of that, is it like what Steve says? Is you're almost getting an instant prescription from data from your watch and your phone? And I think, like, where does the boundary lie with this stuff? You know,
or even if it's not a prescription, you know, a nudge to contact your GP to, you know, ask about upping your medication. So it's not directly prescribing you, but it's marketing.
Yeah, sure. Yeah, I was kind of, you know, just pricing that a little bit, summarising it, but
share your concerns, Steve, for sure.
Because that's my main thing is, like, is it all going to end up cutting out human interaction?
Well, that's the intention, because they're companies at the end of the day that need to make a profit to pay back their, you know, shareholders.
Yeah, but
does it then also help the people that struggle with that, though? Like, there's two sides of it, isn't there? Like, I get it that it cuts down some of the human interaction, but there will be people out there struggling mentally that really find it difficult to have those conversations because they just don't have anybody in their circle that they could have those conversations with. And that's reality. There are people out there like that.
True. Yeah.
Does it help kind of evolve that conversation to be able to say, actually, do you know what? Even though I'm a virtual app, there is support, there is help available. I think that's quite an interesting line for the most vulnerable and the most isolated people out there. There's going to be pluses and negatives for both sides, isn't there? Really?
No, there is, but I think it's. I don't know. Say, for example, if you Google "I want to kill myself," on the top of Google, you will always get Samaritans. A lot of clockwork. Where I think wherever you are in the world, I could be wrong on that, but definitely in England. But actually, most people, I don't know. Ezra might know the data more. He's way more qualified. Might know the data. But actually, it's fine for me to say contact Suffolk Mind or contact this or reply to message. Do this. Do that. They won't do it.
Sorry, I'm just doing this and hope that my boss doesn't ever look through my bookmarks and through my history.
But in Google, you'll normally see the Samaritans up the top. But I think it's just
Samaritans, yeah, 116, 123.
Yeah, but with these apps, the minute it moves into that dangerous world of somebody harming themselves, are we just going to do that default thing? Speak to the Samaritans, speak to this, and you get like the NHS. We've got it on our own website. Yeah, we've got the Get Help page.
But at least with this, you know, with the search, what I'm getting back now is Papyrus, the Samaritans, Every Life Matters, Mind, NHS, Psychom. You know, they are all talking organisations. They're not medication or prescription or drug companies, are they? Do you see what I mean?
Yeah, no, absolutely. But I don't think this is why I don't think just looking at your mobile phone saying, "Oh yeah, I'm having a bit of a rocky week," is actually going to make any difference to it does now.
So I think it depends how they pan it all out. You know, I mean, if they are hell bent on taking the medication route, you know, then I think that's dangerous. If they are going to actively promote, you know, companies like, or organisations like Ezra Mind and stuff like that, Samaritans, whatever, where people can talk, that's a whole different ball game, isn't it? You know, because I would consider that to be helpful rather than a hindrance.
But then would that not just be promoting like a comparison website of just like I don't know, like charities probably would never be able to afford it. So, but what I'm saying is will that end up in like a bidding war of just like, okay, speak to Ian's counties?
I've not considered that.
Yeah, because he's got more money to throw at it than Mind.
Yeah, no, absolutely.
Yeah.
Not that we would, because we're an awareness charity. We're not.
Yeah, I mean it's not something we want to get into. But
you're right, you know, that charities and the NHS, for that matter, would have to consider that within their marketing budgets for sure.
Yeah, which is
wrong. I think it's different. It's a different healthcare industry over in the States where it's all kind of, for want of a better word, it's commercially led, isn't it? And we all know the kind of the faults of the US kind of healthcare industry, the cost of medication, the cost of help and support. Whereas in this country, we're grateful, as much as people say at the NHS. I'm not one of them. I think it's an invaluable service for a lot of people. When that support is available and it's from a non-commercial element, that could be incredibly valuable. I think the data that sits behind, like, I think one of the things for me is like, where's the line? Like, if you're having a shit day and you've had a bad day and you check in with your Apple phone, or what's kind of just giving you a little nudge to say, oh, hang on a minute, Ian, I think you might be depressed. Am I having a bad day, or is it something bigger? Like,
yeah, completely.
How does the data, is it building patterns into that? Is it saying, well, if 3 out of 5 days you feel like that, you might have depression? If you feel like that once a month, actually, is it just a bad day? And I think the data will be quite clever with that, but it's like, where's that line? And because some of that could be quite damaging.
Ian, I think that's a really important point, and there's another dimension to that which concerns me, and I'd like to add, and it's this: if we are relying upon measures of our heart rate and sleep patterns, and assuming that the quality is good enough to be able to capture all of these things, and also talking about measuring cortisol, stress hormones, and hair follicles and that kind of a thing. What we're actually doing is that we are handing over self-awareness to AI.
Yeah.
Rather than developing the capacity to check in on ourselves and say, you know, how am I feeling at the moment? So this is one of the things that at Suffolk Mind, what makes Suffolk Mind a little bit different perhaps from some other local mind associations and other charities, although there are many who are joining us on this journey, is that we think that what we need as a population is to become more aware of the physical and emotional needs, which, when they're not met, give rise to stress and can give rise to anxiety and then depression. So as you said, Dan, people need to become more aware of when they're a bit isolated, and if they're feeling a bit low, sort of say, oh, why is that? Okay, well, I haven't spoken to anybody recently. I've been spending a bit too much time on my own. I'm actually feeling a bit lonely. The feeling of loneliness is not random. That's nature's way of telling us that we need to connect with other people. Just as I'm a bit bored is nature's way of saying, you need to stretch yourself, learn and challenge yourself, find something to occupy yourself. Or I'm a bit overwhelmed. Okay, you need some downtime to process things. Or I'm feeling tired or sleepy. Okay, you need to sleep, thirst and hunger, and so on. Those are all instincts that have evolved over millennia that we need to become more in tune with, and not just block them out with sugary foods or alcohol, or just ignore them. And if we're handing over the responsibility of becoming more self-aware to AI, then I think there's an issue there. Because I mean, leaving aside the fact that we don't know how accurate AI, what assumptions it will base its judgments, its patterns on. There's something about sort of leaving humans where they are, and us not kind of developing our awareness to be able to read those instincts and to see, sort of be more in the driving seat, I suppose.
But I think the thing is that the AI is only going to be as good as the data what's put in it. And let's face it, people lie. Now, if you Google have I got ADHD, and actually, if you want to be seen as ADHD, and sadly, it does seem like there's a trend. There does seem to be a trend of some people wanting to be, because they've got a little bit of this, they want it to be ADHD. You could go online and you can manipulate those results. Exactly. And I know this, and again, I'd like to say, there's, I don't know, it must be a couple of hundred videos on it. I've had a lot of conversation, one-on-one conversation, that Steve, you've been in quite a few of them yourself. Loneliness is like the biggest thing, especially with men. I hear that day in, day out. But I don't think blokes would tell a phone that they're feeling lonely. They would manipulate it, just move it up rather than 4. They'll put it to number 6 because they don't want to. Our heads don't work like that. Have I made sense?
Yeah, no.
So I think
you're right. Manipulation, yeah.
Yeah, absolutely. And yes, I am a supporter of self-diagnosis or self-awareness diagnosis.
Self-awareness, yeah, I think is better, yeah.
But I this is just my perspective, nothing to do with the charity. I really struggle with self-diagnosis, especially when it comes down to like BPD and ADHD, because actually I've known a few people to get wrongly diagnosed themselves. And I've seen that, and actually, I've known psychologists to wrongly diagnose someone in my life was wrongly diagnosed with BPD, so they're getting the treatment for that and the quetiapine and whatever else. But actually, they've got ADHD, so they're on a much different type of, again, Ezra's more qualified to talk about that than me.
The treatment is all completely incorrect at that point.
Yeah, no,
Well, I'm not a psychiatrist, so I'm not qualified to give people diagnostic labels. And but the propensity for people to self-diagnose based on, you know, a quiz on ADHD or whatever it might be, you're right about that, Dan. There's, you know, it's easy to the thing to keep in mind is that the sort of labels and criteria are very fixed, rigid things, and the reality is that people fluctuate from day to day, and labels are not without their critics, even amongst psychiatrists. They sort of debate and revise and question their value. And are we looking at the label or the person? And with big data, are we looking at the data or are we looking at the person? Do we, you know, what is it that we do and don't know about their lives? It's you know, you can't reduce people down to a data
A tag,
as much as
really.
we'd like to.
Yeah,
it's a database.
Yeah, tag. Yeah.
So I think that before we do drift off, though, I don't think we should be telling our phone about our mental health.
I think it needs more exploration. I think I can see both sides of it. Like I'm on the fence, probably leaning more towards your side than I am on the positive side, Dan. But there needs to be more information. There needs to be more understanding of what that data is going to be used for, what the potential implications are. Like I said, what's the third, fourth, fifth evolution of this? Where does it end up? What does it go down? And actually, Apple will probably be acutely aware of that. Are they going to share that information? Don't know. Why would they if there's a commercial element to it? It's like,
yeah.
That's the tricky part. But is it going to come in? Probably.
Yeah.
You know, there'll be enough people that aren't having this in-depth conversation that will just look at the headline at face value and say, Apple introduced app that's going to improve mental health.
Fantastic. I'm in.
Absolutely. You put that over social media, how many people are going to jump all over that and saying, yeah, that's amazing, that's great, thanks very much, I've struggled with this, I've struggled with that.
But they did.
You know?
They did. Exactly. And it's yeah, so yeah, anyway, sorry, I just interrupted you, mate. Sorry, carry on.
No, that's it. That was it.
Yeah. Then but that's the thing, though, isn't it? It's just okay. The impression I got is Apple's going. I don't think we can get sued as a charity, but Apple's going to fix people's mental health, and that's the impression I was getting. I just think it's so dangerous. But I just
well, that's kind of what they're telling you.
Well, I don't think. I think the media is more than any. To be fair,
Apple won't be complaining about the media saying
no,
that.
exactly right.
Absolutely.
Can I just add another kind of dimension to this, which might seem like a little bit of a tangent, but in our day-to-day lives, when we need to solve some kind of a problem, perhaps it's like a relationship issue, maybe having an argument with your partner or with your kids or another relative, maybe it's with a colleague, maybe you've been burning the candle at both ends. The solution to those problems usually involves some level of having to face up to the fact that there's a problem and then making some adjustments. You have to have a difficult conversation. And you might not want to, you might instinctively think, I should avoid the difficulty, I should avoid the discomfort, you know, it will go away. What I'm driving at is that in real life, solving problems requires facing up to difficulties and a bit of discomfort. I'm not suggesting for a moment that, you know, some people believe that all therapy has to be painful and you've got to dredge up the past and all of that. You know, I'm a therapist in one part of my life, and I really don't believe that, and I object to the belief that, you know, it's got to be painful. That's just not true. But it does involve learning, for sure. It involves learning how to do something for yourself, and it involves sometimes having to have difficult conversations. We're living in an age where tech gurus, for want of a better term, are sort of held up as the evidence that you can solve problems with cleverness and enough data, that's just not true. Like, you can't solve a relationship issue by, you know, involving Elon Musk or Zuckerberg or, you know, Apple or whoever it is. They're not going to be able to do that for you with any amount of technology, because it involves human interaction and relationship skills. But I think we're living in a time where we kind of believe we've been sold the idea that you can solve everything with data and cleverness, and that somehow that will allow you to get out of doing the difficult things, the uncomfortable things. And I really have taken us off down a tangent now, but I think that's something to be aware of. I could keep going. Well, I'm a bit of a skeptic about some of these tech gurus, because when I look at Elon Musk's track record and I sort of delve into it, I'm like, well, the first big one for me was when he said that he could download memories off the hippocampus. That's the kind of the memory making or memory maker organ of a pig's brain, or any mammal brain actually. And you could download that memory onto a hard drive, and therefore people were going to be able to survive death. And I was like, well, no, that's not how a hippocampus works. That's nonsense. And then when you look into it, his track record of, is not really that impressive. And I think a lot of the time these headlines are about generating business interest and securing investments in kind of grand projects that don't necessarily bear fruit.
Yeah, completely. And I mean,
that's probably anathema to you, Dan. But like, you're probably like, what?
Well,
like,
no,
like, that's how it looks.
I don't know whether it is. I don't know whether it should be. But I mean, certainly you wouldn't want Elon Musk as your mental health therapist, would you?
I don't want him doing anything for me.
So I think I've already answered through my perspective, if that makes sense, about whether I feel I should report my mental health to my mobile phone. I do not think that anybody else should either. If I'm honest, the reason being is because I do strongly believe that most people will manipulate those results to make themselves feel better. Steve, what's your perspective? Seems to be my buzzword these days.
I completely agree, because I think it takes the whole human element out of it, and because you can cheat. I mean, I'm looking through this thing on pocketlint.com at the moment, which where it's just saying I haven't got iOS 17 yet, so I've not seen it, but where you're taking assessments, over the last 2 weeks, how often have you been bothered by the following problems? Little interest or pleasure in doing things, not at all, several days, more than half the days, nearly every day. Well, if you're feeling shit, it's going to be nearly every day, regardless of whether that's the truth or not. If you're in that 5 minutes, 10 minutes that you're actually filling it in, and your world appears like it's really sort of coming down into a tunnel, and you're feeling a bit shit, you're gonna make that as bad as you possibly can.
Yeah.
Because that's the way you feel at the time. And this is where, because you're taking the human interaction out, where somebody like Ezra, who's trained to, will say, yeah, but God, is that really true? I mean, Monday, Tuesday, Wednesday, were you really feeling like that? Or well, no, actually, Ezra, no, maybe I wasn't. So they're skewing the results, and then it says the assessment enables you to determine your risk level, access local resources, which could be good, but that, as long as it's not a pharmaceutical place, and create a PDF to share results with a medical professional.
Yeah, and that for me, that
but you put in a lot of data at that point.
Yeah, no, exactly. That terrifies me. But
that's a great summary, Steve, and sort of example of exactly how strong emotions like depression and anxiety do warp the way that we see things, and why you do need that kind of human interaction to check things out,
level everything out.
Yeah,
really, isn't
and
it?
Ask the right questions and reframe things and what have you.
Yeah.
So while you're nattering away there, Ezra, what's your view? Should we be using our mobile phone as a solution to mental health?
I don't think we should be relying upon it. I think there may be, if apps are designed in a way to help raise awareness and kind of maybe give people useful pointers about the steps that they can take to support themselves, meaning not relying, going directly to medication and what have you, or for that matter, I gather Mr. Musk is using ketamine, microdosing ketamine himself at the moment. then
Nice.
maybe there's a role for them. But I think what you and Steve have said is about on the money, really. That strong emotions warp the way that we see things, and there's no substitute for human connection.
Yeah, absolutely. Ian, same question, mate.
Probably echo a lot of what Ezra just said there. I think technology can be part of a bigger toolkit, if you like, and I think your phone, your watch can certainly help. Apps can certainly help. Like my partner's got apps that she uses that certainly help, just to have that little bit of switch off, check in, self-reflection. That stuff really, really helps her. Doesn't mean it's going to help everybody.
Yeah.
I think, again, like you kind of said, like Steve, it's also, where does that go? Like, is this all part of a bigger piece right at the top of the tree to say we're going to make AI seem like this all singing, all dancing proposition, and this is just part of what feeds into that? Potentially. Because there's a lot of people on the other side of the fence that are really worried about the impact of AI. I think it needs a lot more exploration for me to give a definitive answer, but my initial thoughts are no.
Right now, it's dangerous.
Right now, it's a no, but 3 to 6 months of research, 3 to 6 months of further information, and all the rest of it, I'm open to change on that.
I disagree. I think it's got to be years worth of data. I think, sorry to be argumentative on that one. It's just And
it depends how quickly they get the data though, Dan, doesn't it? Like if you think of how many people use Apple and iOS, there's millions, if not billions, of Apple users, and they could get that data very, very quickly. But like we've all said, that data can be manipulated. Like a medical trial wouldn't happen over 3 months.
Yeah,
a medical trial would be, I mean, I don't know how the process works, but
it's like 5 years or so.
Yeah,
to do a proper pharmaceutical trial.
Well,
Depends which company is doing it.
Unless it's
and whether we got COVID or not.
Yeah, but anyway, that's me. But on the other hand, it could just be a massive gimmick, because do you remember when Apple announced the screen time? You used to get the notification of just like, you've been on here for 4 hours, you've been on here. Actually, literally everyone turns it off. Like
I don't care.
No, exactly that. So maybe it's just one of those gimmicks where it just falls completely on its arse. But to me at the moment, maybe it's just a gimmick. It's just a marketing ploy, and they've done bloody well out of it. But I just you can't beat humans.
No,
I've not known. You just can't do it. I've not known one person on MANUP, and it's in the hundreds, I sort of keep repeating, where they've said, oh, they're shutting themselves away and using a computer has helped them. And actually the hardball geeks that I know, like Miles, for example, he runs a Bring Back Retro. He did a video, and that's his business of like retro games, blah blah blah. He will turn everything off. He'll go out with the kids. He will do stuff. Do you get what I mean? It's just
because and you've just underlined what we've all been saying.
Yeah, no.
So where he's turning everything off and going out with the kids, he's got human interaction, which is the very thing that we're saying. This kind of it's the route that's gone all the way through this whole conversation, isn't it?
Yeah, no, absolutely that. So I think that's probably our closure as well, isn't it? Really, it's just don't rely on it and speak to people. It really is that simple. I don't think you need to always jump straight to the doctor. I know Dave's probably going to suck his teeth. I don't think you need to wait until the first port of call doesn't always need to be the doctor. It can be the people around you.
It can, absolutely.
Ezra didn't suck his teeth, so there we go.
I agree with you. And go and see a GP, but yes.
I do. You always should see a GP if you feel that you need to, but I do think there's a lot of problems what can be resolved in the home, in the friendships, and all this kind of stuff. And
100%, yeah.
Had people set up knitting groups, football groups, boxing, you name it. I've forgotten the amount of conversations I've had now where their solution is do something.
Yeah.
Our work here is done, my friends.
Good conversation.
It was. Let me hit the
Absolutely.